Good morning. In today's class, we will be discussing about drugs used against Entamoeba histolytica, also called antiamoebic drugs. The antiamoebic drugs can be classified or divided into the following groups. Luminal amebicides, meaning these drugs are only effective against the entamoeba present in the intestinal lumen. This group includes diloxanide furoate, the tetracyclines, iodoquinol, and paramomycin. Mixed amebicides is the second group, also called, or these are effective against both the entamoeba present in the intestinal lumen and in extraintestinal sites, like most often the liver and the lungs. It includes the following drugs: metronidazole, ornidazole, secnidazole, tinidazole, and satranidazole. And then we have, for extraintestinal amebiasis only, there is one drug in this group, namely chloroquine. So at the end of this session, you will be able to classify drugs used against Entamoeba histolytica. What are the different groups to which these drugs belong, the mechanism of action of antiamoebic drugs, the treatment of intestinal and extraintestinal amebiasis, and the adverse effects of the antiamoebic drugs. Diloxanide furoate kills the trophozoites of the entamoeba in the intestinal lumen only. The mechanism of action of diloxanide is not fully understood. That means we do not know how exactly this drug acts. Diloxanide is used in the treatment of mild intestinal amebiasis and in asymptomatic cyst carriers. So diloxanide furoate is usually administered after a course of metronidazole to eliminate the asymptomatic cyst carriers. Chloroquine is basically an anti-malarial drug. So the details of pharmacology of chloroquine we will study under or when we do drugs used in malaria. Now the mechanism of action of chloroquine as an amebicidal drug is it intercalates with the protozoal DNA, forming inter and intra-strand bonding. Now what do we mean by intercalate? Imagine the DNA strand to be like a stack of coins placed one above the other. So what chloroquine does is it slips between into this DNA strand and forms links, covalent bonds within the strand and between DNA strands. So the DNA function is lost, thus killing the entamoeba. The pharmacokinetics of chloroquine as an amebicidal drug is important. It gets completely absorbed from the small intestine and gets concentrated in the liver. There is hardly any chloroquine reaching the large intestine, which is the site of the intestinal amebiasis. So when chloroquine is administered orally, it is completely absorbed from the small intestine and most of it gets concentrated in the liver, where it kills the trophozoites. Now the importance of this, it does not reach the large intestine. Therefore, chloroquine is not effective in intestinal amebiasis. So this is a 3-mark question, and the question can be worded in 2 different ways. Give reason: chloroquine is ineffective in intestinal amebiasis. The answer is because chloroquine is completely absorbed from the small intestine and gets concentrated in the liver. The other way of asking the question is, give reason: chloroquine is used in the treatment of hepatic amebiasis. The answer is the same. Complete absorption from the small intestine, concentrated in the liver, does not reach the large intestine. Chloroquine has multiple uses in hepatic amebiasis, in hepatic amoebic abscess, malaria, where even today it is one of the first-line drugs, rheumatoid arthritis as a disease-modifying anti-rheumatoid drug, used in the treatment of lepra reaction, lupus erythematosus, infectious mononucleosis, and photogenic reactions. Recently, hydroxychloroquine is being tried in the treatment of coronavirus infections. So if you notice here, chloroquine has how many uses? 8 uses we have listed. So you can get a 3-mark question. Mention 4 uses or mention 6 uses of chloroquine. So the uses of chloroquine are hepatic amebiasis, hepatic amoebic abscess, malaria as a disease-modifying agent in rheumatoid arthritis, lepra reaction, lupus erythematosus, infectious mononucleosis, and photogenic reactions. Dehydroemetine or emetine injection. Now this is a drug which was used many years back but is no longer used. But once in a way there is a 3-mark question. The question is, give a reason. Dehydroemetine is no longer used is because of its very severe cardiovascular toxicity in the form of cardiac dysrhythmias and cardiovascular collapse. So emetine injection is no longer used. Now whatever drugs are used for amebiasis are also used for giardiasis and trichomoniasis. In addition, there are few other drugs. So we have MOSTs, metronidazole, ornidazole, secnidazole, tinidazole, and satronidazole. These are administered systemically, that is in the form of tablets or injectable. The advantages, metronidazole was the first drug. These are called benzimidazoles. So metronidazole was the first drug. After that came ornidazole, secnidazole, tinidazole, and satronidazole. Now what are the advantages of these OSTs over metronidazole? They are twice as effective against protozoa and anaerobes. These drugs, when compared to metronidazole, do not have a metallic taste and are less likely to cause nausea and vomiting. And there is no disulfiram-like reaction with alcohol. That is, if a patient is taking metronidazole, if that patient consumes alcohol, there is going to be a very severe reaction where the patient will experience nausea, vomiting, headache, sweating, tremors. That is called disulfiram reaction. This is seen with metronidazole but is not experienced with ornidazole, secnidazole, tinidazole, and satronidazole. Drugs for Trichomonas vaginalis, that is, drugs which are applied topically or locally, include clotrimazole or iconazole pessary, harmycin ovule, pessary ovule. These are different dosage forms for topical application. Natamycin ointment intravaginal, chloramphenicol pessary, povidone iodine pessary. These are locally used drugs for Trichomonas vaginalis. Now, for the treatment of Trichomonas vaginalis, the metronidazole group of drugs can be given systemically. Drugs effective against anaerobes. Now, these are the clinically important anaerobes: bacteroids, fusobacterium, clostridium, especially Clostridium difficile, eubacterium, and peptostreptococcus. So the drugs which are effective against anaerobes include metronidazole, ornidazole, secnidazole, tinidazole, satronidazole. Which are the drugs effective against Clostridium difficile, which causes pseudomembranous colitis? If you remember, we mentioned imipenem, cilastatin. Okay. In addition to that, the metronidazole group are also effective against Clostridium difficile. Mechanism of action of the nitroimidazoles, that is the metronidazole group. This is the mechanism of action against the anaerobes. Metronidazole, tinidazole, ornidazole, in the anaerobic environment within the bacteria, they get chemically reduced to the active form. Now this active form of the drug causes the DNA to be cut. Scission means to cut, scissors, to cut, causing DNA strand scission in susceptible bacteria, that is the anaerobes, and it is bactericidal for anaerobes. So, for a drug to be effective against the anaerobes, in this case what happens, within the anaerobic environment of the bacteria, the drug, that is metronidazole, ornidazole, secnidazole, imidazole, and satronidazole, they get reduced to their active form, which cuts the DNA of the bacteria and thus kill the bacteria. All these drugs are well absorbed on oral administration, metabolized in the liver, and excreted in urine with differing half-lives. They also enter the CSF, that means they cross the blood-brain barrier, they enter the bone and abscesses. The half-life of metronidazole is 8 hours. That means metronidazole is given 3 times a day. All other drugs of that group, that is satronidazole or ornidazole, are given once a day. The adverse drug reactions include very common metallic taste, especially with metronidazole, headache, vomiting, ataxia, vertigo, red discoloration of urine. Please remember this. We will sometime later, while doing anti-tubercular drugs, we will be mentioning rifampicin, which also causes discoloration of urine. Disulfiram-like reaction with alcohol. This is more so in the case of metronidazole. Coming to the uses. Used in amoebiasis, Giardiasis, Trichomoniasis, anaerobic infections, non-specific vaginitis, pre- and post-operative prophylaxis, pseudomembranous colitis. These are the uses of metronidazole, ornidazole, imidazole, secnidazole, and satronidazole. Now, the doses are important not only from your prescription writing point of view of your practicals, but also for clinical practice. Metronidazole is administered 800 milligrams per oral 3 times a day for 7 days. Metronidazole is available as 400 milligram tablets. So the prescription, when it is written for amoebiasis, Giardiasis, Trichomoniasis, whatever, 2 tablets 3 times a day for 7 days. The instruction to be given is avoid consumption of alcohol. Very important. Tinidazole is 1 gram per oral once a day for 3 days. Secnidazole and ornidazole are given as 2 grams per oral single dose. We will just mention the names of some urinary antiseptics because these are asked as 2-mark or 3-mark questions. Nitrofurantoin is a urinary antiseptic. What we mean by urinary antiseptic is they have no systemic action. Administered orally, they are very rapidly absorbed and rapidly excreted in urine. Nalidixic acid, if you remember, was the first quinolone which was used. Then we have a drug called methenamine. Now this methenamine maleate is administered as a tablet. Decomposes to formaldehyde at when the pH is less than 5. So along with methenamine, mandelic acid and hippuric acid, any one of these are given together so that the urine gets acidified, and methenamine in the acidic urine decomposes to release formaldehyde, which kills the bacteria in the urinary tract. Phenazopyridine is also used, is a drug which is used as an urinary analgesic. That is, if there is pain in the urinary tract, phenazopyridine relieves this pain. Thank you.